back 10-12 times slowly with some constant pressure. If you feel some pain points.
Yanis, how can we deal with pain on ulnar side of the wrist?
Cut it off. Most effective way. Yeah. You mean pain here, right here on the basement of wrist?
Yeah, when you're trying to arm wrestle, cup, hold things, do pull-ups, anything.
It's question, of course. What's the reason? Is it some really some structure injury, some partial tear, or could be in connection point in ligament or tendon? Is it just overuse? Is it just some trigger points? But few most basics, I would rubber or belt. I would say first of all, as any injury, we don't want any pain, so pain-free system, but blood flow in this area, or some easy rubber. So you are working with this. It's called ulnar deviation. If it's
yes, it is.
Yes, it is. Thank you. We can do the same with a whole chain, because very possibly that there is problem in some chain as well. So start same position. Start with wrist, then add arm and triceps. So I would say do some 20-30 at first, just with wrist. Take little rest. Do some 20-30 with all arm together. But best is if it's without the pain, you can do same with cable and belt. Same movement, same. I will do for balance with left arm, or you want to see right arm. Okay, it doesn't matter. So same movement here, and you could be creative and do it in different ways, but work here. If it's not making pain worse, usually you would say it could be a little bit sensitive for beginning. You do like 1, 2, 3, 5, and then it's like, okay, it's getting better, easier, movement goes good, no pain, or pain even less, that's good. If it's opposite, you start, first few feels good, and you do more, and it's getting more sensitive, more painful, discomfort is growing, stop, you are doing too much, don't do it through pain. But you can try to work with this one. Second, I would say there could be some trigger points in finger and wrist flexors, and also in finger and wrist extensors. So any serious acute trigger point in this region could give you some pain. So or a small roller or some myofascial ball. Just press against here near the bone. First, just from elbow to wrist, not really on joint, forward back, 10-12 times slowly with some constant pressure. If you feel some pain points, then you can do some circles, wrist curls, fingers, movements, and similarly here on extensors. Or it's against again on a table, or you can do it against wall. It's how you find it better. Usually some trigger points here in finger extensors can give. If you see it's moving here, they can give as well some pain and discomfort to ulnar basement point of wrist. And what about stretching? Yes, you can do as well. This one I love a lot.
Yeah.
For kids, you know.
This is Illuminati, Jans.
Yeah, press against, or same with what people do for ulnar nerve flossing, or up and down. So to stretch out all this area, or you can even stretch and do some together with chest muscle to feel some stretch. Usually you will feel maybe a little bit in stretch, maybe some triceps lateral head, maybe a little bit here in ulnar side of forearm. Yeah, that's what I would say. Taping, kinesia taping could help, but it will not change the reasons. And very important is if there are some serious reasons why it's happening. For example, you are systematically overusing your muscles which are doing this motion and they are weak, but you are still overusing, the pain will definitely come back and it will be painful. So in a very acute period, some rest for beginning, and then you need to strengthen as well fingers, wrist flexors, ulnar wrist deviators. You need to strengthen them systematically, but don't overdo, otherwise you will get back some problems again. So clear?
That's it? Clear.
Some more questions?
No, thank you, Janis.
Yeah,
Thank
so
you.
stay healthy and love arm wrestling.